Hi, this is Dr. Todd Large from Large Chiropractic Clinic, and I'm here with my patient Laurie. And Laurie came in after a pretty severe auto accident. She did actually wait some time before she came in for treatment, so some of the symptoms that she initially had actually got worse over time. But thank goodness, most auto insurance policies also have a rider in there that allows you to get medical treatment. That's really smart, in an emergency situation, if you go to the ER, if they do x-rays, that type of thing. But they also cover other things like massage and chiropractic. I'm speaking for Pennsylvania here. I believe it's the same in most states. So I asked Laurie to come here and just talk a little bit about some of the symptoms that she was having, and then we'll present some of the treatments that we were doing, and then talk about how Laurie feels about Large Chiropractic Clinic. Mm-hmm. So what were your symptoms like?
The worst was my knee. It was swollen, and after even a while, it would just keep getting bigger and bigger. And I didn't know exactly what was wrong with it. And that was the main reason I actually came, because of being a bartender and stuff, always running around, being on my feet. I felt the water. It felt like there was like water in it. And then I was like, I'm finally going to the chiropractor and seeing what's wrong. And then you told me it was actually sprained.
Yes.
And I was shocked, because people think like that it's like pain, that it'll be a steady hurt and you'll know exactly what it is. And I dealt with it my accident happened on February 5th of last year, and I came in December. So it was a while till I actually got it treated.
So you tolerated the knee pain for a long time.
Yeah.
But you were also dealing with some other things.
Mm-hmm. Since I was in the accident, I got really jarred up. So my scalenes were really bad, and it was actually making my whole entire hand tingle. And sometimes I wouldn't even be able to like hold stuff because it would hurt so bad, and the tingle would just freak me out basically. So finally I started coming here, and the tingling got a lot better. He fixed my sprained knee that I didn't even know that was sprained. And then in my scapula was really bad, and that's fixed. So
you had not only the tweaking of the ligaments in the knee, but also because of the chronic swelling and just a slight dislocation is the wrong word, subluxation is the correct word, where the joint is just slightly off kilter. So things don't track the way they're supposed to, causes irritation, causes functional problems in that area. And then when you have swelling, it affects the muscles around it also. It will actually decrease the power of the muscles, kind of a protective mechanism. But after 9-10 months, it was becoming really difficult for you to tolerate.
Yeah.
And then the tingling in the hands, Laurie had mentioned that even driving her car, she had to keep switching hands just to drive, because the hands and arms would go numb. So coming here, I did an extensive exam on her, made sure that there were no permanent damages or concerns to completing the treatments that we did. So initially, basically started with some trigger point therapy, some electric stim, some minor stretching. It had been 10 months, so I was not worried about stretching damaged tissues. And then from there, working into some other therapies, including mechanical traction on her neck. That helped a lot with the tingling. We also looked at some vitamins also. If you have a low B12, that can contribute to the tingling. So Laurie got back on her B12, and that's helped with those symptoms also. And then another thing, that because it had been so long, the area around her left shoulder blade had just all gummed up. And luckily we have high power laser here also, 10-watt laser. So I was able to laser that area and then do trigger point therapy and some stretching. And it just increased the blood flow there. It decreased the pain in the area, and we were able to make a lot of progress on an area that kind of resembled concrete when we started, not wet concrete, but dry concrete.
Yes, it was bad.
So you feel like your experience has been worth the time and the effort to get here?
Yeah, it has been. It helped a lot. So when I would be done with a shift at work, I would limp home and stuff because it was just, the pain was so unbearable sometimes. But now I don't limp at all, and I'm able not to deal with it because I don't have to deal with it anymore.
Right.
Because it's
all
not,
up 90% better at this point.
Yeah.
We're really tapering
It's a
down
lot
treatment
better.
at this point. I'm projected to be done with Laurie within the next couple of weeks, and hopefully have her back to 100%. She's mom also, so she needs to have the mobility and the strength and be able to bend her knee and work. So we've returned her not only to a point of having a lot less pain, but also restoring her function, which is the end goal. So thanks for coming here and sharing some kind words.
Thank
Appreciate
you.
Thanks.
All right.